All right, welcome to your ultimate high-yield explainer for decoding hepatitis B serology. Look, if you're a medical student, you already know this is one of those notoriously confusing topics that just seems to show up absolutely everywhere. But today, we're going to break it down completely and help you crush those tricky board questions with total confidence. We're going to take this giant jumble of letters and antigens and transform it into a straightforward, incredibly logical cheat sheet. By the end of this explainer, you'll be able to look at literally any patient's lab results and easily classify their exact status. You won't just be memorizing a table, you're actually going to understand the story of the virus. So, here's our game plan for today. First, a quick intro to Hep B serology, then we'll look at antigens to track current infections, followed by antibodies to understand the immune response. After that, we'll master the infamous window period. And finally, we'll break down vaccinated versus natural recovery. Jumping right into part 2, antigens and tracking current infection. Think of antigens as literal pieces of the actual virus. When these guys show up in a patient's lab results, it means the virus is active right there on the scene. It's essentially the footprint of the invader. Now, our very first marker is HBsAg, the surface antigen. This is the very first serologic marker to pop up after someone is exposed to the hepatitis B virus. Your absolute golden usmle mnemonic here is S equals still infected. If HBsAg is positive, your patient is infected right now. So, the crucial point you've got to remember for test day is the timeline associated with that surface antigen. If HBsAg sticks around and remains positive for 6 months or longer, well, the infection is no longer acute. You are officially dealing with chronic hepatitis B. Next up in the antigen category is HBAg, the envelope antigen. The memory hook you absolutely need here is E equals easily spread. Why? Because this specific marker correlates heavily with active viral replication and generally high infectivity. In fact, if a pregnant patient has a positive HBAg, there's a much higher transmission risk for perinatal spread. E just means they're highly contagious. To keep these two straight in your head, just lean on the letters. HBsAg simply confirms they have the virus right now. The S means still infected. Meanwhile, HBeAg acts like a massive alarm bell, that they are actively replicating the virus. The E means easily spread. One tells you the virus is there, the other tells you it's multiplying and dangerous to others. All right, let's move on to section 3, antibodies and the immune response. So antibodies are essentially the immune system's weapons. Analyzing which antibodies are present and exactly what form they're in allows us to play clinical detective and figure out the patient's precise exposure history. Our primary focus here is the core antibody, known as anti-HBc. Guys, this is a massive clue for your board exams because it implies natural exposure to the virus. I'm going to repeat that because it's so important. Only natural infection causes anti-HBc to form. It is never, ever seen from vaccination alone. If you see this positive, that patient has tangled with the real live virus. Now, the core antibody comes in 2 distinct flavors, and you absolutely must memorize this distinction. The IgM version points to an acute or recent infection. It's actually your classic window period clue. On the other hand, the IgG version tells us the infection is older. It's either fully resolved or the patient has transitioned into a chronic infection. Just remember, IgM is immediate, IgG is long-term. Let's tackle section 4, mastering the window period. Conceptually, a patient progresses through a pretty specific timeline. They go from an early exposure phase in those first couple of months through a really tricky middle window phase around month 3 where things get super confusing, and then, ideally, they move right into a recovery phase by month 6. Take a look at this dangerous window period right smack in the middle of the timeline. The surface antigen, HBsA, has cleared out of the blood, but the protective surface antibody, anti-HBs, hasn't actually shown up yet. If you only tested for surface markers right here, the patient would look completely negative, and you would totally miss the infection. So when you see the scenario on test day, remember these exact steps. During this specific window period, your only positive serologic marker is going to be IgM anti-HBc. The surface antigen is negative, the surface antibody is negative. It is literally just the IgM core antibody acting like your clinical lighthouse in the dark, proving the patient is currently in that acute window phase. Finally, section 5, vaccinated versus natural recovery. This is a classic USMLE trap. So both of these patients will test positive for anti-HBs. Remember, anti-HBs represents total immunity. But a positive anti-HBs alone doesn't actually tell us the whole story, right? We have to use our other clinical clues to deduce exactly how they earned that immunity shield. This table right here is your foolproof differential diagnosis key. Think about it. A vaccinated patient was only ever injected with surface proteins, so they're only going to have anti-HBs. Everything else will be negative. But a recovered patient? They fought the entire real virus, so they'll have the protective anti-HBs, plus they will be positive for total anti-HBC, the core antibody. That is exactly how you tell them apart instantly. And as a really quick memory hook before we wrap up, please don't confuse your antibodies. Anti-HBs means full, complete immunity. Anti-HBe just indicates that the virus is currently replicating less. It happens after HBe-Ag seroconversion, meaning the patient is simply less infectious, but not necessarily totally immune. Do not let those similar letters trick you on a multiple-choice question. To make absolutely sure you've mastered this cheat sheet, I want to leave you with a rapid-fire board question to lock it all in. If you get a lab report back and your patient's only positive marker is IgM anti-HBC, what phase of the timeline are they currently in? Keep these simple rules in mind, rely on the logic we covered today, and absolutely crush your studying.